Hi, and welcome everyone. Thank you so much for being here at our second weekly workshop on the coronavirus. We are offering a workshop every week. Last week, we recorded for 2 hours because we had so much that we wanted to share about coaching and about the coronavirus. And we are going to continue the weekly sessions, and we're striving for keeping them at closer to an hour from here on out to make it manageable for everyone. And what we're doing here is we're talking about the self-coaching model, which is a fantastic tool that we can all use to understand what's going on in our minds and with our emotions and to provide support for ourselves and one another. And we're also talking about medical updates on the coronavirus and doing some actual live coaching. So my colleague, Dr. Melissa Kwak, and I are both certified life coaches in the Life Coach School. We worked with Brooke Castillo and our other classmates through a wonderful process of learning so many coaching tools that we've been able to provide for our coaching clients and that we've used in our own lives to help us so much through whatever it is we may be struggling with and setting goals for ourselves and accomplishing what we'd like to in our lives. So today we'll be starting with the self-coaching model, and I'll be sharing that and talking a little bit about coaching. And then I'll turn it over to Dr. Kwak, who will share medical updates on the coronavirus and talk to us a little bit about our brains and neurobiology and what's going on in our brains, which will be very valuable. And I just want to quickly introduce myself. I'm Bridget Sampson. I am a life coach, certified life coach. I'm also the CEO of Sampson Coaching and Consulting, a retired communication studies faculty member, a TEDx speaker, and an author. And I'm doing this to help myself as much as everybody else because I just want to be of service and help people and support people through this very unprecedented time. And I know that you all want to do the same. So I hope you'll share this widely with anyone who can benefit from it. Let's start with the self-coaching model. The self-coaching model has 5 parts: a circumstance, a thought, a feeling, an action, and a result. And the result will then provide evidence for the thought. I'm going to explain it very briefly and walk through an example of it. And the example of it is from my own life, especially a couple weeks ago when I was really struggling in the beginning of being home and figuring out working from home. So the circumstance is a fact. It's simply something that exists in the world or something that someone has done. It's a fact. The thought is a sentence in our mind about that fact. Our thoughts generate our feelings. So the feelings that we have are sensations in our bodies that result from the thoughts in our mind. So I think a thought and it makes me feel a feeling. This is really empowering to realize because I used to think before I was exposed to all of this that circumstances out in the world are what created my feelings. And now it's so liberating and freeing to know that it's my own thoughts about those circumstances that are creating my feelings. And we know that this is true because 2 different people can have 2 totally different thoughts about the same circumstance, and therefore those 2 different people will feel very different feelings as a result of what they're thinking about the circumstance, right? The feeling then drives an action, something that I do or don't do as a result of what I'm feeling. And the action leads to a result, an outcome, a final result of what it is that I have done. Now, this can be something that's long over time, long-standing patterns, or it can be just something that I observe and notice in a short amount of time. I was thinking this and that made me feel this way, and then I took this action and this was the outcome of that. So the example I'm giving here to keep it simple is something that I'm asking you to imagine is just happening in 1 hour of time. We're just looking at 1 hour of time, okay, here? So the coronavirus exists in the world. That's our fact. My thought might be, I can't work from home. I can't work from home. I run a business. I'm a trainer. I'm a speaker. I need to be out with the people on stages and in corporate training rooms doing management training and public speaking training. So I was having the thought a lot, I can't run my business from home. I can't work from home, right? How does that thought, it's not a fact, it's a thought. How does that thought make me feel when I'm thinking it over and over? Anxious, right? So the feeling of anxious is generated by the thought, I can't work from home. What's my action? Well, lots of options here, lots of things I've been doing. And so one action might be I go on social media for an hour because it's comforting and I can check out and not think about work, right? And now this is not to say that being on social media is negative in and of itself, because I've been spending some time on social media, limited time, where I'm giving support, I'm getting support, I'm connecting with people. And that's wonderful if it's intentional and it's conscious. But it's a conscious choice. I'm talking about here that mindless just surfing to get away from the things that you don't want to think about, right? So let's say for an hour, I spend that time on social media. I don't even remember what I saw or what I did there. It was just, for me, wasted time, right? And it's not always, but we're saying in this 1 hour. The result is I didn't get any work done at home. Therefore, it reinforces the thought, I can't work at home, right? So it's a loop. And the evidence of not having achieved any work then really reinforces and provides evidence for me to keep thinking that I can't work from home, okay? Now, really important to say that we don't want to judge this. This is a tool for awareness. We don't want you to say, oh, okay, I see it now. I shouldn't be thinking that. I've got to stop thinking that. Because guess what? When we force ourselves to stop thinking something we've been thinking or actions we've been taking with harshness and self-judgment and self-criticism and resistance, usually they get stronger. The thoughts and the actions become more powerful. The thoughts and the feelings and the drive to take that action become even more powerful. We want to look at this with self-compassion, with curiosity, and as much as possible with no judgment, to just simply see this is what's happening. I see it. Oh, okay. Now I see I've been creating all this. Okay. And once we've really understood it and love ourselves through it and see it and have compassion about it, we can, if we want to, we don't have to, but if we want to, once we've really looked at this, we can then choose if we want to think about new thoughts. And we might keep this thought, or we might sort of slowly over time let this thought go and what it's creating in our lives and have a new thought. So for me, some of the thoughts I've been thinking more recently are, I can create online training programs. I can email my clients and ask what kinds of creative things that they're doing to provide training in this environment where no one can meet in person. And I can offer to help, and I can reach out to more coaching clients and do coaching over Zoom, right? So these are all thoughts that lead to more empowered feelings and more motivating feelings, which may lead to actions of actually reaching out and making calls and sending emails and maybe even putting programs together, getting on my computer and figuring out how to use Zoom more effectively, right? Some of these actions that I've been taking when I'm thinking more of the thoughts around what I can do rather than thinking about what I can't do. So again, I'm not suggesting that we should look at what we're thinking if it's creating a result we don't want and be critical on ourselves and harsh. Never. Please don't do that. We just want to see it and say, oh, okay, I see that I am creating my results. I see what's happening. And then what do I want to do with that? Maybe I want to journal about it. Maybe I want to talk to a coach about it in more detail and dig deeper into it and see what's going on there and see what patterns are there. Right? We use this in so many realms, with weight loss, with setting goals around careers. You can start with the result line, right? And if you start with the result line, that's a goal. What do you want your result in this area to be? And then you work back up. What action do you need to take to get that result? What do you need to feel to drive you to take that action? What do you need to think to generate that feeling? So it works in so many ways. If we're compassionate and patient and we don't push too hard and too quickly to see what's there and move away from it and resist it and change it, but welcome all of it and study it all as scholars who are fascinated by what's going on in our minds and our emotions. So that is a very, very brief introduction to the self-coaching model. I'm happy to talk with you more about it. You can find more videos that I've created on it. You can find lots of information out about it on the Life Coach School podcast, which of course is free, with Brooke Castillo, which is fantastic. I want to say a couple of words about coaching before we move on, because we will be bringing people on for mini coaching sessions, a couple of 10 or so minute mini coaching sessions. People often misunderstand coaching to think that it's giving advice. That is not coaching. Often when people say, oh, I'd like to get your advice, a lot of the time they don't actually want advice. They want to talk things through and they want support and guidance in figuring things out for themselves. And that's what coaches provide. We trust and know and believe that you know what's right for you. And that if we help as coaches to draw that out, that you're going to get a much better solution or idea or way of helping yourself and supporting yourself and loving yourself than we could have given you by trying to give you advice. So coaching is what we call holding the space, being fully present for the person you're coaching, listening actively, completely setting yourself aside, hearing everything that the person is saying with no judgment, right? With compassion, but also not getting into the story with them, right? So we're careful not to do what we call jumping into the pool with the client. We are lovingly separated from the story that client has so that we can help them see what they're creating and how really much they do have within their power, right? So it's that active listening, and then it's asking great questions. It may be paraphrasing, I'm hearing you say this, is that right? And checking back in to see if our understanding is correct, to see if their understanding of what's going on with them feels accurate. And then we get to questioning and asking you questions to dig deeper. So it's really challenging. It can be really challenging. And I know it is for me. I've had my life coach for over 2 years now, and she really helps to ask those questions and to say things back to me that I've said to help me dig much deeper and gain much greater insight into what's going on with me, because I get it all out of my mind, get my feelings out, and then she asks me questions so that I get even more out of my mind and I get even more understanding of what I'm feeling and how I'm generating those feelings with my thoughts, right? And then we work it through to figure out, what do I want to move toward thinking and feeling, and what makes sense for me? She doesn't know. She knows what's right for her as my coach, right? I don't know for my clients. So I help them to generate what they would like to do. What are their goals? What would they like to think and feel? And how can we work together to come up with those answers? So that is the self-coaching model. That is how coaching works. And it's a very brief introduction. And the biggest things I would say to remember are, it's really first and foremost about awareness of what you're creating. Don't get mad at yourself about it. Don't be self-critical. Be curious, be fascinated, be aware of what you're creating. Sit with it for a while, really understand it before you push too hard to move toward changing it. And when you do really understand it and take ownership and have great awareness, then you can really be empowered to think about the choices you actually want to make and being intentional as much as we can in what we want to think and what we want to feel and what we want to experience. And that is not to say that we always want to feel positive feelings. There are many situations where we want to choose negative emotion and thoughts and experiences. Grief, for example, someone dies is a circumstance. Our thought is, this is tragic. This is so sad. We feel sad. We act in the action line. We grieve. We cry. This is so healthy. This is a choice that we want to make, right? So it's not all about positive thinking. It's just about being aware of it all, of what we're creating, and studying that really with an open mind and seeing what's happening and seeing where we can make choices and thinking about how we would like to make those choices, what we would want them to be. So thank you for being with me for that brief introduction to the self-coaching model and to the idea of coaching. Now I would like to turn it over to my colleague, Dr. Melissa Kwak, who is a phenomenal professional, a family physician, a life coach, a wonderful, amazing human being who has studied psychology and personal growth and development in such depth, and brings all of that together in what she offers as a coach and as a physician. So I'm going to turn it over to her to share her knowledge and her take on what's going on this week. So it's all yours.
Perfect. Thanks, Bridget. So I wanted to, well, first of all, I have to give the disclaimer again. These are my opinions and coming from me. I'm not representing my employer in any way. I am an employed family physician. In addition, I want to change up the program a little bit. I was going to talk about the medical facts next, but I feel like this is a good segue instead to talk about our brains a little bit. I was going to talk about that as well, and I want to do that first. Is what Bridget said about us not being our thoughts and about the model being a tool of awareness. To me, is this perfect segue to talk about what's kind of behind the scenes of all this. Like what Bridget is talking about is kind of like the practical, like some of the practical things that we can do to make sense of our life experience and help create the life experience we want and understand it. But what's creating this life experience in the first place seems to be the hardware in our skull, our brains. So I want to talk a little bit about that today, because presumably all of our thoughts, our feelings, and our actions are all driven by complex physiologic processes happening in our brains. So I'm going to give a brief overview. I'm not a neuroscientist. If there's anyone in the audience that is, please understand this is very simplistic thinking about our brain, but in a way that I think can help make sense of this. I like to think of our brain as a piece of equipment that kind of runs the show, and that there's two types of software that run. And I'm going to call those the primitive brain and the prefrontal, or the prefrontal cortex. Okay. So our primitive brain is the part of our brain that has to do with more fast and automatic thinking, feeling, and acting. It tends to be emotional based. It tends to be survival oriented. So tending towards triggering thoughts, emotions, and actions that will improve our chance of survival. A lot of this is happening unconsciously or subconsciously. And this part of the brain also tends to drive our pleasure-seeking behavior, and it is oriented towards efficiency. So when our primitive brain is running, it's quick, it's automatic, it's knee-jerk, and it's meant to be simple and conserve energy. Our brain doesn't have to use a lot of energy to be running in this primitive sequencing. So some examples are really things that have become hardwired in us that we don't have to think a lot about doing. So even just walking and talking or driving a car, being able to add 2 + 2, and then some of our more primitive emotional responses like feeling disgust and feeling fear. Those are coming from the more primitive wired part of our brain. And we know when we're living more from this part of our brain's hardwiring, when everything feels urgent, when we're living in that sense of urgency, when everything feels like it has high stakes attached to it. We tend to live more rigidly when we're more primitive brain driven. We tend to be stuck in patterns, and we often don't understand our own behavior. We can be very confused about, I don't understand why I keep doing this thing I don't want to do. So that's more the primitive hardwiring. Now this is not bad or good. Actually, it's necessary. We need this type of brain wiring and functioning for survival, and to conserve energy. These are all patterns that have become habits, if you will. When something becomes a habit, I would say it's tucked into this primitive functioning of the brain. But the other side of things, we also have this part of our brain, all of us do. And this is the more evolved part of the brain that humans appear to have the largest one of the animals. And it's called the prefrontal cortex, or I'll call it the prefrontal for short. Now, this is the part of the brain and the functioning and wiring, if you will, that involves more slow and effortful and deliberate thinking, more calculating. It's more conscious. You're aware when you're doing this. It's more logical. And this is being utilized when you're creatively problem identifying and problem solving in your life. And some ways you might know you're living more in this state of, or using this part of your brain more, would be if you are setting goals and directing your behavior towards that goal. When you're solving problems, not from emotion, but from logic. And when you're utilizing metacognitive skills, and that's our ability, and possibly the only animals on the planet, we're not sure, but it's utilizing our ability to step outside of our life experience and think about it. So to be the curious observers of our own life experience, to think about our thinking, to think about our feeling, to think about our acting. Both parts of the brain, super, super important. We need them both. But what happens in life in general at any time, but especially when we're approached for something new, like a pandemic, we tend to revert more to the primitive brain wiring and living from that space. And that just often doesn't serve us well. And so I want to just give a few tips about how to strengthen and perhaps utilize this prefrontal more. And this is by no means an exhaustive list here, but a few things we can do to activate the prefrontal. We can practice becoming aware of our feelings and feeling them without judging them or responding to them. So this might include naming your bodily sensations. Our feelings, if we're really get present with them, will come with some sort of bodily sensation. So we can get present and quiet and still with our feelings and name those sensations and get curious about them. You know, what might the sensation be? Why might I be having this sensation? What automated thoughts might my brain be giving me, either consciously or subconsciously, that might be behind this sensation I'm having? And then we can get comfortable with just discomfort in general. So I'm a huge Brene Brown fan. I don't know if any of you have heard of her, but she started a podcast recently. And her first episode, the podcast is called Unlocking Us. I'm going to plug that. I'm sure it's all going to be amazing because she's amazing. But the first podcast was about FFTs. I highly recommend it. F is a swear word I'm not going to say here on this program. And F and T is first times. So F blank, first time. So basically when we're going through a first time, a first experience with something, and the podcast dives into this deeper, but it's explaining why it's completely normal to feel discomfort in such a time, but in a way that's almost the price of growth as a human, and the price of being able to tap into our prefrontal cortex. So our prefrontal cortex is, to I guess personified, if you will, is lazy. It won't activate itself unless we're kind of driving it to activate. It's much easier to live from that primitive brain because it doesn't require much energy to do so. So to activate the prefrontal requires energy, and that's presumably where some of that discomfort is coming from. It's like a resistance to having to think about something purposefully, to expend that energy, to stop and not just react and slow down and deliberately respond. And then the last piece of advice for today to activate the prefrontal is to get back to writing down the facts. So this would be the circumstances in the model that Bridget just reviewed with us again. Write down the facts. These are not subjective. Facts are not interpretations. Facts are not stories. A fact might be, it is 80 degrees out, or, you know, my shirt is blue. So get back to the facts, and then ask yourself, what do I want to think about this? And going back to last week, we talked about some questions to ask yourself. So if you write down the facts, what do I want to think about this? What might be the most helpful way to think about this? What might be the most creative way to think about this? What might be the kindest way to think about this? And then lastly, using the prefrontal cortex involves planning in advance. Well, at least that activity strengthens the prefrontal cortex. When we're using our primitive brain, we're just reactive in the moment. And again, sometimes we need that. Sometimes life calls for just responsive immediately in the moment. But a lot of times it's not that helpful. So even doing something simple like planning one part of your day 24 hours in advance and committing to that activity, exactly what you said you were going to do and exactly at the time you were going to do it, and then doing it and then rewarding yourself for doing it that way. That could be a verbal pat on the back, like nice job, way to plan that in advance and then carry it out. But doing that sort of behavior over time strengthens your ability to use that prefrontal cortex. So that's a brief review of the brain and how it tends to work. Now, any questions that come up about that I can address?
But we want to know, at this point, before we move into coaching, do you have questions about the self-coaching model? We gave a really quick intro to it. There's so much more to it. It's still right here. Or questions about the neurobiology that Dr. Kwak just shared with us, how our brains work and our prefrontal cortex compared with our primitive brain, fight, flight, freeze brain. So I have a comment in the chat I'd like to share that says, I think sometimes when you're feeling emotional, it's hard to recognize that that's what's happening. Yes. Yeah. The emotion just can take over and we go completely into that primitive brain, which is usually fight, flight, or freeze. And it's really hard to see that that's happening. We can often see it right after, and we often take the action that feels like the most soothing action, or that will give what feels like it will be the greatest relief in the moment. And then after the fact, we can look at it with the prefrontal and say, oh, there were other options that I was, I guess, clouded in a way and I wasn't able to see in that moment. That's my very layperson explanation of how it feels for me. What's your thought on that, Dr. Kwak?
Yeah, no, I agree. And any recommendations on how to address that was a follow-up too. And I think just practicing awareness and just compassion for it all. Like there's no perfect recognition and awareness of this we're going for. Any recognition of what's happening, of our life experience and what's happening is empowering in and of itself. Just being aware of that. And then the more we practice awareness, I think then we're more able to step in and intervene and when we want to with the process, with the whole emotional process. But it just takes practice of for me, it's just reminding myself, like, okay, just slow down. And what are you experiencing right now? Like, what's going on? And I tend to do that when I do start to feel urgent and like that high stakes, like I was talking about. When I catch myself like getting into that, I'm like, oh, okay, wait, like that's when I'm kind of getting out of control here. Like, what's really going on? And I just practice doing that when I get that trigger. So for me, that's my, I guess, trigger when I feel urgent and whatnot. So maybe you can find one of those triggers for yourself, even if there's a repetitive or recurrent feeling that's coming up that's not serving you well, or maybe that's driving a behavior that you're not particularly fond of. Then identifying when you get that feeling, that's your alert. Like, oh, it's time to slow down and step back. Like, what's going on here? And just practice that awareness.
And that's actually a great segue into coaching, because that's part of what we do in coaching, right, Dr. Kwak?
It is, but can I give a few medical updates first, since I switched it around? So
yes,
sorry.
I was so captivated by what you shared. I completely forgot that part. Please.
So, and I actually don't have that many. There's still so much conjecture and anecdote and not a ton of new facts to go off of. So a quick review is that COVID-19 is the illness that's caused by this new coronavirus. And the symptoms are still mostly what we had reported last week, which is the cough and fever and shortness of breath, by far being the most concerning constellation of symptoms. And then some people also having other run-of-the-mill cold symptoms with it, a runny nose, a sore throat, sneezing. So all of those core symptoms are still thought to be the same. Now, since last week, there have been more reports of possibly gastrointestinal symptoms being much more prominent than we had thought before. And out of China, a study showing perhaps even 50% of people have gastrointestinal symptoms leading up to respiratory symptoms. And those can be decreased appetite, diarrhea, abdominal discomfort, nausea, and that sort of thing. So that may be more prevalent than we had thought, though those symptoms don't seem to be the symptoms that are leading to severe illness. It's not like diarrhea seems to be leading to needing to be hospitalized for IV fluids. It still appears to be that the people that are suffering from this the worst, it's hitting the lungs very hard. So that was a new revelation. And then there's been case reports of smell and taste being altered, which is kind of interesting with this. That's not become a symptom that's being tracked, as far as I know, by the Center for Disease Control, the World Health Organization. Again, this is more anecdote and stories coming out of places that have been hit pretty hard already, but just kind of it's just an interesting tidbit at this point that for some people, their smell and taste seems to be impacted during the course of the infection. But still, the vast majority of people who are getting this are having mild to moderate symptoms and recovering just fine at home on their own. And just a few data points. The global, as of this morning, the World Health Organization said there's a global, the number of positive cases globally is 416,686. And there's been 18,589 deaths, which that calculates to a 4.5% mortality rate globally based on those numbers. In the US, we've had about 68,440 positive cases and 994 deaths, which is about a 1.5% mortality rate. Now, these numbers, they're going to change so much, I presume. I think most experts are thinking this is still, we don't know where this is going to fall. But I do know, just based on my experience and of my colleagues, that we are talking to patients who have very classic symptoms of COVID, but they're not severe enough to meet the criteria to be tested because testing is still very limited. And just based on our anecdotal experience, we know that the number of positives is way beyond that 68,000. And if that's the case, then that mortality rate would be even lower than that 1.5% here. But again, that's just been my experience and case reports of my colleagues. So still the way to prevent this, getting the infection, is to avoid contact with the infection. It's spread person to person. It's still thought to be primarily spread through respiratory droplets, possibly now some fecal oral spread as well, as we're learning more about the gastrointestinal symptoms. But the way to prevent is the same as has been preached across the country. And that is social distancing, 6 feet away from other people, regular washing of your hands, which is at least 20 seconds with soap and water, and or use of hand sanitizer that has at least 60% alcohol base in it, and avoid touching your face with unwashed hands. And if you have been exposed, it can take 1 to 14 days for symptoms to appear. And then if you are sick, of course, we want to avoid spreading it to other people. So the same rules apply that I just said, but also please stay in at home if you're sick. And if you are mildly sick and have to be around someone, please wear a face mask in that situation. As of right now, that's the only time that a face mask is being recommended for a person who's not a healthcare provider. It's just if you're sick and coughing and you have to be around someone, then we advise wearing a face mask. Make sure you're cleaning and disinfecting surfaces in your house regularly if you are sick, even a couple times a day. The CDC has a good information sheet for appropriate cleaning supplies for such, and most of them are pretty run-of-the-mill home cleaning supplies that we probably already have, and they give instructions for making a bleach containing cleaner as well. And as far as treatments go, there's still no FDA approved treatment, and there's still no standardized treatment protocol. I'm sure you've all heard there are some experimental uses of some medicines that are being studied. We do not advise taking these unless instructed by your doctor. But they're the same ones we talked about last week. There's some antiviral medications being studied, some anti-malarial medications, and one of those is also a rheumatologic agent that has been used to treat lupus and rheumatoid arthritis. So those drugs are still under investigation. Nothing that's been standardized as a treatment protocol yet. No new updates on the vaccine yet that I've heard. Vaccine trial is underway, but that we won't have more information about probably for some time. It can usually take well over a year to get a vaccine introduced into use. And then the last treatment that's now being looked at is using plasma, which is obtained through a blood collection from someone who's already recovered from COVID. So this method has been used for other illnesses in the past, but people who have recovered recently from COVID presumably have high levels of antibodies against the infection, and distilling that down into the plasma and giving that to people who have the infection in some very small studies so far does seem to be shortening the duration of the illness and decreasing the severity of it. So that's a very promising treatment that I think New York is looking at most intensely in our country right now, last I heard. So those are the updates I have.
We had a couple questions, Dr. Kwak, and I can just give them to you. You don't have to worry about looking in the chat. There was one question about what, if there's any information about what percentage of the cases are that people contracted the virus through contact with other people who had it versus from surfaces.
Oh, I haven't seen data on that. That's broken that down. I don't know.
Yeah. And there's a lot of talk and guessing about that. So if you don't know, then probably no one knows, I would say. You just don't know, but be careful. Don't touch surfaces if you don't need to, right? Just take.
Right. We know it's a means of getting the infection for sure, but
it's possible.
Yeah.
And the other question was if you have a prediction for how long the shelter in place will be necessary.
That's a great question. So my best prediction is going to be at least 2 months, if not longer. Mm-hmm. But and this is not my medical expertise, this is my opinion. I think that just depends on our evolving philosophy around this too, right? Because right now the philosophy in most governing bodies, and I know in my state in Illinois here, is that without life, we can't have livelihood. Mm-hmm. So we're prioritizing doing the strictest things we can to save lives, with knowing of the potential economic fallout of that. But I mean, that philosophy might evolve on a personal or global or governmental level. I don't know. And at what point that might happen, I don't know. So for sure that could change if that philosophy changes. But right now that's, and until we have more information about this infection and hopefully get some treatments and better preventions in place, then that seems to be the way of it right now. That we're doing whatever it takes to save lives. And so that I would say 2 to 3 months wouldn't be surprising at all.
Okay, thank you. So thank you very much for those updates. We really appreciate it. And we have some time left to do a couple mini coaching sessions. So would anyone out there like to volunteer to be coached? And all that we'll ask is just that you share whatever it is that you're struggling with or you want to talk about. And we'll just spend about 10 minutes, one of us at a time. So Barb Hendrickson.
Barb is my aunt. If you're okay with me coaching, I would coaching you as a relative. I would love to do this.
That would be a blessing to me. Yeah, beautiful. That'd be awesome.
What you got going on?
Well, I think one of the things that I'm dealing with right now, I think you answered some of it with the brain explanation, but I'm feeling a little bit anxious at times when I'm not available. I was on my phone yesterday, literally from the time I woke up until about 1 a.m. So there's so much, I'm an introvert, so all of this connection, it's It's like I have more connection not being connected than before this all happened. But I feel like if I put my phone down, or if I set aside time to do a Bible study or to read a book, I'm going to miss something, and somebody might need me, and I'm going to miss them. And I'm having a struggle with that, kind of a deep struggle with that right now. So help.
Well, what do you think the problem actually is? Is it that, are you afraid you really wouldn't help someone, or do you not like the anxious feeling, or is it something else? Like, what's actually a problem about this scenario in your mind?
I think I feel selfish if I'm not available. If I'm doing something for myself, in that moment, I feel almost like I'm not being of value to someone who might need that time more than I need it.
So what does it mean to be available?
When the phone dings.
Okay.
When the phone dings, I have a quick response. That is how it has played out. Availability has played out almost in immediate response.
Okay.
In the last couple of weeks.
How much time do you think would have to go by for you to consider yourself inappropriately unavailable? That makes sense.
Wow. I don't know. I haven't actually analyzed that or thought about that. Inappropriately unavailable?
In your mind, yeah. Like if 10 minutes went by and you hadn't responded, is that
like in this situation, I would probably say 15 minutes.
Okay.
Yeah. I mean, so I feel like I'm being driven by that, definitely that primitive brain.
Mm-hmm.
And everything's urgent.
Mm-hmm.
When it may not be, right? I don't know.
So how often do you want to be available? If you had to pick a time frame.
I would like an hour of quiet, like an hour or an hour and a half of just nothingness. And just enough time to focus on one thing without having Facebook give me an alert or a text message, or it's been hard to get anything actually accomplished because there have been so many interruptions, and I have felt obligated to address every one of them.
So why don't you turn off the alerts? What's keeping you from turning off the alerts for an hour?
Maybe fear that I'm going to miss something that's important to either me or someone else, that I'm not available for somebody to help them through a circumstance or answer a question. Maybe just FOMO, maybe just fear of missing out for myself, you know?
Yeah.
I don't know.
Totally. But do you want that to be your role right now? Do you want to be the person who's there every second of every day?
That's a really good question. And I do take that role on with a lot of people in my life. And I find value there, to be honest with you. I find value in myself. I find that that's part of my gifting too, is being able to encourage someone else. But I feel like I'm emptied out and I don't have a whole lot really left to offer at this point.
So it sounds like maybe you want to be there regularly, but maybe not in exactly the way that you're doing it now. That's what I'm hearing. So what if you were available and just embrace that? Does that seem, what do you think about if you just embrace that. I'm not telling you to do that, but just try that on. Like, okay, I'm Barb and I'm going to be the person who responds to every ding immediately and is available 24/7. Like that's the role I'm going to take on here. And just and decide that. So how would that feel if you just envision like deciding that? How does that feel to you?
Instead of it being imposed upon me, making a decision that this is my role right now and settling in as that's okay. And everything else can be put by the wayside for a while. Is that what you mean?
Yeah, if you wanted to. I'm just suggesting you just try it on. Like, okay, this is going to be my identity. This is Pandemic Barb. And I'm available 24/7. Like that it was a deliberate choice. Like, does that deliberate choice feel good to you? Does that feel like something you'd want to do?
It hasn't felt good. So I think that maybe no, it doesn't feel good.
Okay.
Yeah.
And the alternative, well, what is the alternative to you in your mind? If you're not responding to everything and on call 24/7, what's the alternative?
I think the alternative is trusting that other people are going to get their needs met in another way if I'm not available to them. So I'm not the end all be all of people getting their needs met. So there are lots of people in the world that are available to help one another, and I can help myself. That's how I'm feeling right now. I need to take the time to help myself through this situation and set boundaries for myself so that I can find peace in the midst of my own daily life through this.
Do you believe that those people could find help elsewhere if you turned your notifications off for an hour?
Now that I think about it, yeah, it's kind of arrogant to think that they couldn't.
Where else could they get help?
Well, from their mothers, from for other friends, from their siblings, the same places that I'm getting help. And so there are lots of other people.
And what might be the benefit of them getting help from somewhere besides you?
Maybe understanding that they don't have to rely on one person, that there are other people available and other viewpoints maybe and other sources of comfort outside of maybe what they think is their go-to. So that's kind of what I'm thinking.
And what might be the benefit to you?
Some quiet time and some really focused, uninterrupted creative time, study time, prayer time, without something constantly pushing in on that and kind of stealing that away, because I'm desperate for that right now.
So does that trade-off sound worth it to you?
Yeah, it does. I have to let other people's feelings go though, and my own need of them needing me. And so that's kind of what I'm working through, is just releasing them to other people's care.
Which, in your own words, it has benefits to it, right?
Yes, it does.
To everyone
Absolutely.
involved. Yeah. Love it. So Barb, I love you. I'll hand it over to Bridget so that she can get one person in too. But thank you for letting me coach you, and listen to that Brene Brown podcast if you get a chance, because you're also just in one of those FFTs. The first time dealing with this, fumbling through, like the rest of us. Like this is a new life experience, and oh, this isn't working that well for me, so I'll move on and try something else and let's see. And I think
Right.
that's just what you're in right now, like all of us. Not doing anything
Awesome.
wrong, just fumbling through an FFT.
Thank you so much. I appreciate it, Mel.
Yeah, I love you, Barb.
I love you too. Bye.
Way to go, coaching a family member. An extra added challenge for you there. So that was thank you, Barb, and thank you, Dr. Kwak, for teaching us so much. We can all relate to that. I think so many people are feeling the same thing, Barb. I know I am, trying to be there for everybody, and we put all this pressure on ourselves, which is fine, as Dr. Kwak coached you, if we want to choose to do that. But if we're doing it mindlessly and unintentionally and feeling all this anxiety about responding to everything, that's more the primitive brain that Dr. Kwak talked about, like the fear of missing out, FOMO, right? Or fear of someone judging, or fear of, something happening. And the prefrontal is when we engage, we say, okay, I want to mindfully choose how much am I going to engage? How am I going to engage? When am I going to recharge? And how do I recharge for myself? So thank you both for that. So much came out of that I think all of us who are watching can really benefit from. And so I'm going to do a little mini coaching. If Kevin is still available, I'll follow Dr. Kwak's lead and coach my cousin. So we'll call this the family coaching session. Okay, cool. Yeah. And so if you're willing to, with me, try to use it, if we can you can just talk through whatever's going on, but we'll see if there's an opportunity to try to use the self-coaching model just to help people see how that works. But first of all, just tell me what's going on, what you want to talk about.
Yeah, I think the biggest issue I'm having is sort of something that you touched on in your presentation, which is the way I would frame it is really, this is such an overwhelming event that it's draining so much of my focus that it's like, and I've seen other people say this too, it's like, oh, I'm a writer and thought I'd be writing an album now. And I'm like, I'm not getting anything done. Like, even though like it's the perfect time, you're home all day and you've got all this time. For me, like, well, first of all, I've got other challenges in terms of we got 4 kids at home now too, and my wife works and stuff. So I actually feel like I have less time than normal. All the people who are like, well, I got all this time. What should we do? Watch movies and stuff. I'm like, geez, we have less. I don't know. But for me, the problem is the time that I do have to work is like, I'm really having a hard time focusing more than normal, just because it's hard to like not think about this, and it's like, it's really sort of also just not in terms of like affecting how much productivity I have. It's also kind of like having a toll on my mental health, because it's like like you're getting like worn out mentally by like just thinking about this all the time and the ramifications of it. And like, just going on social media, like you said, looking for more updates, more news, like what's going on, what's the latest. And so, it's the only thing we talk to, pretty much anybody, if I see my neighbors now from across the street, it's the only thing we talk about, so it's really like, I need to figure out a way to like, be like, I don't have to focus on this 24/7 and it's not helpful. And, but it's been really challenging.
Mm-hmm. Yeah. Okay. Well, you're not alone. A lot of people are feeling this way. So I'm curious, I heard you say that you want to think that you don't have to, you're having the thought, it seems, that you need to be thinking and talking about this all of your waking hours. There's something that's driving you. Is that correct?
Yeah, it's right. It's kind of like, not so much like I'm obligated to, but it's just, really overall, it's just hard to get away from it, like, so.
Okay. Well, and if we try to plug in one thing here, one feeling that I heard you say was overwhelmed, right? Is that a feeling that you're having a lot? Is a feeling of overwhelm?
Yes.
Okay. So what thoughts can you identify? And you gave us lots of thoughts in what you shared, which is great. And what's like one thought that really pops out that you think, and it's often our thoughts are at the subconscious level, but when we coach, we can kind of pull them out and go, well, I've kind of been thinking this, which is contributing to why I'm feeling so overwhelmed. So do any thoughts come to mind for you that may be generating and feeling this constant feeling of overwhelm?
Just this, the one thought that kind of pops to my mind is the uncertainty of it, is trying to get some certainty from it and say, okay, it's going like that question before, how this is going to be like this, or like, how it's going to affect my business, or like how it's going to affect my wife's business, or what kind of an emotional impact is it having on my kids. Like, it's so, I don't think I've ever had, or anybody really had so much unknowns going on in their life, as we do right now. So
Yeah. So the uncertainty could almost be a circumstance. You could,
Yes.
I would give you that as a circumstance.
Yeah.
Things are uncertain. Things are uncertain with your business. You run a business. Things are uncertain with your 4 kids. And when are they going back to school? Things are uncertain with the whole world, right? So we could even say, right, that it's simply a circumstance that you are facing a lot of uncertainty, right? And so
Yeah.
what are you thinking about that? Like, what are you thinking about all that uncertainty?
So it just really like, I mean, it obviously causes anxiety, but I think my response to that is just to try to get more information, but it kind of becomes silly at some point because you're just grasping at straws. I'm not gonna, you know, not gonna like be able to like, solve this in my brain and be like, okay, we got to figure it out. It's going to be X and X going to happen. And then whatever, we're just going to have to like, accept the amount of, like accept the uncertainty, I guess, to some extent.
So, okay, so let's pause there for a second because this is really important. So you're thinking, I need more info. I need more info. I need more info, right?
Yeah.
Is that a persistent thought, right? And,
Yeah.
And that makes you feel overwhelmed. There's uncertainty, absolutely. And then if we're constantly thinking, I need to gather more info. I need to go to the news. I need to go here. I need to go there.
And some of it is just pure curiosity. Like, what's the latest? Like, it's, I'm very curious. So it's like, what's going on today? Like, what are they saying now?
Right. And this is right. And you can, and that's a it's easy to justify that thought and say, I do need more info. We all want more info. Right. And I'm also hearing you say that at a certain point, you realize you probably have enough info. Right.
But you're not going to get any more anyway.
Right. No more. You just checked 10 minutes ago or whatever it is, right? And yet your brain, does sound like, I don't know if you heard the part that Dr. Kwak was saying with the primitive brain, like the primitive brain has that fear-based, like get more info. You need more info.
It's definitely not the advanced part of my brain. That's like, yes, logically, if you spend 30 more minutes on Twitter now, you'll make some progress on this or whatever. No, it's just kind of like, it's also part of it is the sort of like wasting time is also reassuring because it's like, okay, other people are feeling this way too. And so that's like, you're not crazy, like to, be feeling that way or whatever. So, but it's none of it's really, being helpful or productive, not to the extent that I'm, doing it or whatever. So,
and just for a second, I think it's important for you to just see that this is what's happening and that you're so aware of it. You just shared it all so clearly and eloquently, and you don't have to necessarily change it. We're not in coaching. We don't say, change this immediately, start thinking something different, start doing something different. Because then what can happen is our brain will push back and fight back and resist and like dig in its heels even more, right? So how can you kind of help yourself just to see that this is what's been happening without judging yourself for it and telling yourself you're doing something wrong?
Yeah, I mean, just talking about it is helpful to put it that way, but I do think it's, I think while it's normal, it's not, it's making the situation worse for me because I'm fixating on it and it's not relieving any anxiety. It's actually adding to it, I think. So.
Okay. Well, since you said that, let's just finish it up. And because if we look at the actions that you're taking, that helps us just with no judgment to understand more of the whole cycle of what's happening. And I heard you say Twitter for 30 minutes, but what else comes to mind when you're dealing with uncertainty and you're having the persistent thought, I need more info, and that makes you feel overwhelmed. But you also said it makes you feel anxious. What do you do? What are the actions you take?
The actions are just like going on, my things are, I go to Twitter, I go to the New York Times, just like basically online. I don't really, watch any cable news, thankfully, but it's just like online stuff to find out more information or, just reading different articles about, what's going on. And a lot of it is too, it's not just like the data about or information about the virus. It's also a lot of political stuff right now. It's like I really am going into a dark place with that, with like, frustrations of how this is being handled and like real frustrations and anger, like real anger on my part. And it's like, there's no productive outlet for that. Like, it's not, getting myself all upset about it and being like, even though I think it's justified, it's not being productive. I'm not taking any actions on it. There's nothing I really can do about it. So, it's a sort of a dark hole to go down on that.
Right. So. Right. So what's the result of all that? Like, what comes of that? What happens?
The result is like, to me, it's just like, the result is probably like severalfold. One is like, it's adding to anxiety. And two, I'm like not being productive, it's not making the best of the situation that we've got here. So
you have more anxiety, and you're
that's productive.
saying, saying that you're not being productive is actually another thought more than it is a result, right? So here we go into a whole new model, right?
Out of this loop.
So let's just look at that. A lot of people are thinking right now, I'm not being productive. And that's not necessarily a thought that serves us. You get to choose. I know for me to keep thinking I'm not being productive doesn't serve me well, because then I just spin and I want to go on social media more, because it's like I'm not being productive anyway, and I'm telling myself I'm not being productive. And like you said, it just puts me into the dark hole of continuing it, right? So what if we try to, that's fine if you feel like you're not being productive. You can keep that thought. And are there other thoughts that you can think alongside of that, or in addition to that, about what you're doing with your time that feel more affirming, but that you can also believe? Like, what are you doing with your time that we might be able to, someone might define as productive as well? You're taking care of your kids.
I'm taking care of the kids. There have been some real benefits to the situation too, which is that, I'm with my kids all the time now, so in normal life, I really didn't see them that much, typically on the weekday, on certain days. So now, and I'm kind of like, you're almost getting to know them better or whatever. So, and, I'm taking more collective bike rides over the last 2 weeks than the rest of the 10 years I've had them before put together, so that's fun. And we playing soccer out in the front, and just doing that at lunchtime instead of being in the office away from them. So those are great. But so that's good. I am getting some work done. So that's good. I'm spending more time with my wife too. So, those are productive things, I'd rather be doing more of those things than, sort of spending, or I don't know if you wouldn't want me to say wasting them because you think that's judgmental, but like spending time sort of researching these things.
Yeah. So the idea here is not to say, oh, I want to completely get rid of these negative things that I'm thinking and feeling, because they're just there and we can let them be there, and that's okay. And we can also look how easily you shifted and your energy totally changed when you're like, I'm doing all these bike rides with my kids and I'm spending so much time with my kids and my wife. You immediately seem to start to feel better, than when you're telling yourself I'm being unproductive and I'm watching all this news I shouldn't be watching, right? So it's fine to keep all of it. You don't have to.
I mean, they're both true.
Exactly. That's the beauty of doing this work, is like, okay, I'm thinking and feeling these things over here, and I'm also, if I shift a little, I can think and feel these things. So how did it feel when you were describing all the things that you're doing with your kids?
Yeah, that was great. I mean, it felt great. It felt empowering, uplifting, it was positive.
Feels empowering, uplifting, positive. Okay.
Yeah.
Okay. So what do you want, what do you want to think about the situation? What do you want to think about all the uncertainty? What are some thoughts to try on? And it doesn't mean that you're going to have to believe them, or I won't hold you to them. I won't come back and be like, Kevin, are you thinking this all day?
It's okay if you do.
Just brainstorming, like what is possible or available to think about all of this that you might want to choose to think?
About the whole situation?
Well, about the uncertainty.
I just think just acknowledging it and saying it's okay. I'm not going to be able to change that really. And it's out there and it's okay. So acceptance, really just accepting it.
Okay. So how does, so this is the same situation, right? There's uncertainty. That's a circumstance. And one thought you're having, which is totally fine, no judgment, is I need more info. And another thought is it's okay that it's uncertain.
Right. Yeah. Right.
So one generates a lot of feelings of anxiety and overwhelm, and more thoughts of self-judgment and, that you're not doing it right. And this other area, how does it make you feel to say it's okay that it's uncertain? We just don't know.
Yeah, it's a little bit, kind of like, it's okay. So let me just go do what I can do today. That's kind of like kind of freeing to be like, all right, let me just make the best of today. And, we're here now, or everything's okay now. So,
And it doesn't have to necessarily feel good either. A lot of times we can do some work to just try to get to neutral, to just maybe do a little bit to get from really anxious and overwhelmed to, I feel pretty neutral. I feel like I'm just going to do, that's kind of the feeling I got from what you just said. I'm just going to do what I can today.
Yeah. I mean, it feels good to like focus on something else really. And just really for me, it's really like, trying to get a control of my mind, really, and to
Yeah.
say, to be like, don't go this way, go this way. And it's been difficult, like, so I'm just
Yeah, it's very difficult. It's difficult
yeah.
for all of us. That's why we like this tool, because it just helps you see what your mind is doing, and
Mhm.
hopefully just without judgment, and
Right.
it's funny that you said you can see your mind going in places, without it being your choice. And it's been compared to like a toddler running around with a pair of scissors. Like that's what our brain can be like just, causing all this damage because we're thinking all these things. But we wouldn't scream and yell at that toddler. We'd be like, okay, let me explain to you why playing with
We
scissors
might.
well, you might, but your higher self would be like, I should
Right.
probably explain to the toddler why
Right.
the scissors are
Yeah.
dangerous and what we
Right.
can do instead, right? So that's what we're trying to help everyone
Right.
and ourselves to do here as well, is just kind of see that our brains are going a little haywire right now, like toddlers with scissors running around.
Right.
And it's creating this additional suffering and additional anxiety and impact on top of all the anxiety and impact that we reasonably are having about this virus. What do you think
Right.
about that?
Yeah, no, absolutely. It's not helpful. Yeah. Yeah. I mean, to right, acknowledge that as like, yes, it's really like seeing it, what's going on for, right?
Yeah. So how do you want to think and feel about let's just start with today. How do you want to think and feel about today, Kevin?
Today I just want to, like, I think that what I can do just to make it the best day possible is just to focus on the things that are making me feel good, and spend time with my kids, which I've done already, and accomplished a few things for work related, and
Mhm.
then spend some time with my wife later. That really kind of, just even saying that and thinking that kind of makes me feel in a better place and more positive and happier, and
Mhm.
so,
Mhm. Kind of
so
focusing on what you can do and what you do have
yeah,
control over.
focusing on the things that, like, I'm enjoying. Like, I just thinking about it now, when I'm working, I'm actually enjoying it more than
Mhm.
obsessing about this other stuff. So
Right. Right. So I think that sounds like a great plan. And I would just
yeah,
hope that you can do that with self-compassion and patience.
yeah, oh, yeah,
And that when you find yourself, as we all do, dipping back into the thoughts of, I need more information, or this is so uncertain, this is so scary, that's totally normal. And that's okay. And you can be at peace with that too, and allow that to be too.
great, good.
Yeah. Thank you for coming on,
Thank
Kevin.
you. No, this is
So good
great.
to
Really
see you.
happy
Give
I'm
everybody
here.
my
So
love, and
right,
love to
I'll
talk to
do
you
that.
again soon. Take
Yeah,
care.
I'm gonna listen to the rest. So I'll be here.
Okay,
Okay.
cool. All right.
But this is so familiar to me, Kevin, what you're going through, that I just wanted to offer that when we have those I need to thoughts, that's almost always a clue that almost 100% of the time we're going down a primitive brain rabbit hole. When it's an I need to, that's that kind of urgent and high stakes um, thought that's going to take us down that hole. And again, that's okay, but that could be one of those times where that could be one of our triggers. Like when we start noticing that word need to coming up, that could be a time to sit and be like, okay, wait, I'm in primitive brain mode here. What's going on? Like, get back to how we're feeling. Because when you said it feels so hard to control your mind right now, I totally get that. That's me like half the time. But I also know it's because we're trying to solve for an emotion. We're trying to solve for a feeling that isn't a problem to solve for. Like that we're trying to solve for anxiety or overwhelm, which is a feeling that our primitive brain necessarily gives us as part of a survival mechanism. And when we're trying to solve for a feeling that's hardwired in us like that to come up, I think that leads to a lot more of the actions that then lead us to just further spinning in that cycle. And to me, that's where this practice of, and this is a whole new philosophy on life that I've learned, this practice of getting into the space of this feeling isn't a problem to solve for. Like the feeling can be there and I can allow it and breathe through it and not respond to it. To me, this, when this primitive brain gets going, that's like the perfect time to practice that. Because it's not, what if the feeling's not a problem? Like what if feeling anxious right now or scared isn't a
Yeah, I
problem
think
to solve
for
for?
me, right, for me, the problem is not the feeling; it's the actions I'm taking in response to the feeling that are
Right.
causing the real problem.
Right. And we take those actions because we're trying to solve for that problem. It's like, oh, if I take these actions, then I won't feel that way. Like, at least subconsciously, that's what seems to be happening. We're trying to get out of that feeling. And so if we don't try to get out of that feeling, then there's no action to take. It can just be there.
Right.
So just
Right.
a different approach as well. Yeah.
Yeah, it's sort of like what both of you and Bridget were saying really reminds me a lot of really meditating, which is sort of just like just observing, not judging, whatever, just like, okay, observing. So.
Exactly.
Yes, exactly. I highly recommend anyone out there who meditates or is open to meditating. Now is the time to really, really, solidify your practice. And I've been meditating in the morning and at night, and it really helps. It really helps. I know everybody says that and it sounds cliche, but it really is a good time to strengthen or just keep going with or begin a meditation practice, because it really does help. As we were talking last night, Dr. Kwak, I wrote down some of the things that you were saying. You were just rattling off that were such gems. And what you and Kevin were just talking about just reinforced what you said about how we don't have to act on our feelings. It's really empowering to know that we're going to have all these feelings and it's fine for them to be there, and we can take a moment and we don't have to act on them. We can just allow them to be there and acknowledge them. Oh, wow, I'm feeling really anxious right now. I don't have to do anything about that. I can just feel it and sit with it and allow it to be there. And the reality is, for most of us, we've had the experience of when we just allow the feelings, they actually pass a little bit more easily than when we resist them or we act out in ways that we later know weren't what we really wanted to do. Yeah. So I think we've lost our volunteers. We're 15 minutes over the hour. I knew we wouldn't be able to do an hour because we really want to engage in this conversation with everyone and provide support. But we did have a couple more people who had volunteered to be coached who had to leave the call. So I want to really encourage everyone to come back next week. We're going to do the same thing next week. We'll bring the self-coaching model again with a little bit of a different spin. Dr. Kwak will bring any medical updates, and we'll bring new content, a little bit of new content, and we'll open it up for a couple of on-the-spot mini coaching sessions as well. And we know from viewing them ourselves a lot in our program, just watching other people be coached can be so helpful. It's been so helpful for me to have Barb and Kevin come on. And last week we had 2 folks come on who are willing to be coached. So please come back next week. If you had your hand up and you wanted to be coached, we're here for you every week, and you can reach out to me outside of the class as well. And I want to thank you all so much for being here, and we hope to see you next week. Please let people know we're going to be here for the next few weeks, just doing the same thing and having this conversation and offering coaching. So please let your friends know. It's the same Zoom link, same time, same place, same 2 of us. Any final words, Dr. Kwak?
No, thanks, Bridget. Thanks everyone for coming and being vulnerable and volunteering. That was awesome. Thank you.
Thank you.